Abercrombie. I am the co-chair of Human Services, and I'd like to welcome you all to our informational forum today regarding nursing homes. We know that nursing homes, in my opinion, have been hit one of the hardest in this state during the pandemic. And we're here to talk about where we are, where we're coming from, and what the future looks like. I do want to take this opportunity to thank everyone that's participating today, and especially our workers who have been on the front line. None of us have ever been in this situation before, and it's been really challenging for everyone, but mostly for people like yourselves who have been on the front line. And the unknown had to be very unbelievable for you through this whole pandemic. So I know I speak for my colleagues when I say thank you, thank you, thank you for all that you have done. I would like to give my co-chair and ranking members an opportunity to say good morning. Senator Moore.
Good morning, everyone. I echo the statements of Representative Abercrombie 10 times. You know, your backbone for us, more than just words. We know that we only made it to where we are with the help of so many of you all, the sacrifices that you made, not only as individuals, but as families. I mean, everybody had to go back home to someone else and not knowing what you were taking back to your family. So from the bottom of my heart, I thank you. I hope that we'll hear, I know there's a lot that still needs to be done, a lot that we need to be responsive to, but I'm hoping that we also have some successes that we could think about, so we know that we've made some benchmarks that we can move forward. So thank you. Thank you, Representative Abercrombie.
Thank you, Senator. Representative Case.
Thank you and good morning. And it's so good to be on a meeting every day with Representative Abercrombie. I'm looking forward to hearing what everybody has to say. And, you know, our nursing homes have been a big part of this whole pandemic, as Representative Abercrombie said. And I look forward to hearing the discussion. And yes, Senator Moore, it's good to see you too.
He's so fresh and we haven't even gavelled in yet. Senator Purcell, I'm not sure if he's on here. I didn't see him, but I don't want to take it for granted that he isn't.
I texted him and we'll see.
I'm sorry, say that again, Representative?
I texted him and he has not responded, so.
Okay, if he comes on, we'll give him the opportunity to say good morning. I do want to just take a quick opportunity to introduce our new Vice Chair of Human Services, Representative Lieber. For some of you that may not know, our Vice Chair, Representative Garibay, is now our House Chairwoman of Aging. So we'd like to say congratulations to her. I'm very excited for her, and I know she's going to do a great job. And now we have Representative Lieber, who is going to be our new Vice Chair. So I want to welcome you, and this is a great opportunity for you to see who we work with and get a little bit more information about what's going on with nursing homes. So thank you for being here. We really appreciate it. So with that, why don't we get started with this forum, because it's not about us, it's about you and the residents and everything that's going on in nursing homes. So first, I'd like to introduce Mairead Panter, who is our long-term care ombudsman. Mairead, I cannot say enough great things about her. We're really lucky to have her in the state. She has been on the front line of this pandemic, whether it's making sure that loved ones can see their loved ones, fielding questions to helping us navigate this system. So with that, I'll turn it on to Mairead, who will start with her opening remarks. Thank you.
Good morning. Thank you so much, Representative Abercrombie. Good morning to Senator Moore and ranking members. I also want to thank all of our legislators who have joined us this morning to talk about this important topic. I'm going to jump right in because I want to give time to residents and staff and other individuals who are going to present today. As you addressed, Representative Abercrombie, our long-term care communities and our nursing homes in particular have been incredibly impacted over the past 2 years. We continue to see a response to COVID and new variants as they pop up. We have been hearing from residents that they feel they're in a better place and that they have more protection related to the vaccine and boosters. So as Omicron came and impacted the residents, they did feel that they had more meaningful access to visitation. Thank you to all of you who helped in the past 2 years really advocate for that and how much that has meant to them, and that through this latest wave, they felt they had greater success in addressing their individual needs in a holistic way because of the access that they had. That access has also been incredibly important due to the staffing issues that we're seeing. We have such challenges related to staffing across the board right now. I do not believe that the minimum staffing levels are being consistently met. We're seeing this when we're going into homes, we're talking to residents as well as care team members. We're hearing that staff are picking up many shifts, and with that, you have a greater risk of abuse and neglect just because people are worn out. They can't give any more of themselves. We're seeing a large use of pool agency staff, which are staff that come in from outside of the nursing home. This is very challenging for residents because these individuals don't know their daily routine, often what their needs are. It takes a lot longer to have their needs met. Or if the person doesn't show up, it leaves the regular staff having to pick up a lot of those gaps and work even harder. We also see accountability related to abuse and neglect right now, because if you try to hold someone accountable for something, they don't come back, or they go and work in a different building if they're part of the pool. We see shifts that go unfilled, even if they're booked. So the nursing homes may be reaching out and booking people for shifts, but they may not be showing up. We're also finding there was a regulation that was passed a few years ago related to the posting of staff in the building, having access to that for residents and family members. And we're finding that that's not regularly being updated to really reflect who is in the building and who is providing care. And this makes accountability very challenging. We know that, from an administration's point of view, it's one more thing to do. But for residents and family members, that's the only way they really know who's providing care and what the staffing level is. I think the legislature worked very hard to increase the minimum staffing level as well as the accountability there. And so that's why it's really important that we see that followed up on. To that point, we are seeing the biggest change in administration in buildings that I've ever seen. With that comes some gaps in education. So we're really trying to do education and outreach related to residents' rights, what our expectations are for the homes in our state. We have a lot of new staff in administrative roles where historically they would get a lot of training and have the opportunity to learn from peers, have the opportunity to kind of get their feet wet and grow within the system. And we just don't see that right now. It's kind of like they're jumping in and just the expectations are really high. For residents, having quality care is very challenging. For the first time in a long time, outside of the midst of the pandemic, we're hearing about challenges related to getting a shower once a week, having individualized schedules, regularly accessing time to be out of bed or attending rec activities, even accessing the bathroom without really long wait times. And this really goes back to staffing. The staff in the homes are working as hard as they can work, but if you're 1 to 13, 1 to 15, there's no way that you're going to be able to meet individualized needs. And so that really falls on the shoulders of the staff. And I think that that's why some staff members are making the decision not to be in the field anymore because of that level of pressure, and that what we hear from them is they feel like they're letting their residents down. So you have the commitment there, you have the desire to provide quality of care. They just don't have the team in place to be able to do that. So we really need workforce development in order to see individuals in these roles as a career and the care that they give. Residents want to be able to get up and have meaningful, full lives, spending time with peers. And that's why I think also having the access to visitors want to be able to come in and just visit. We do have essential caregivers, and those individuals go in a way that is essential to help support those residents, especially when there's times where there are gaps. in staffing, and to be able to take the time to sit and provide nutritional support or do the things in the way the resident wants to direct them being done, versus just having things done as quickly as possible in order for the care team member to be able to move on to the next person. So I'm very thankful for the commitment that all of you have made to providing the highest level of care for the individuals in these settings and that we serve. I'm available and open to any questions. Thank you.
Thank you, Marie. We're going to hold questions to the end because we want to give everyone the opportunity to present their information at this point. So, and then we will have time at the end, I promise. But thank you so much for what you've done. I know this has been challenging for everyone, but I really want you to know on behalf of the legislature, it's been great working with you, and we're really thankful that we've had this opportunity to work on this issue together. And we're not done. We're getting, we're dabbling in tomorrow. So thank you for all you do. Next up is Martha Leland. Martha is a member of the Resident Council. And Martha, when you start your testimony, could you kind of talk about what is the Resident Council? I don't want anybody to assume that they know what it is, whether they're part of the Zoom or watching us. So if you could explain that, that'd be great. Good morning.
Good morning. Thank you for having me. I'm sitting here with Lindsay Jessup, who's the ombudsman, and she has facilitated helping us to get going. The resident council I meet with once a month, sometimes 2 times, to talk about issues. We go through a litany of all the departments, who's of concern, what's the concern, everything right down to housekeeping and the kitchen, as well as social work, the nurses, the aides. And anytime anybody has a problem, they bring it to resident council. It's wonderful. We have 2 floors here. I'm at Touch Points in Manchester. I've been here for about 8 years, and I pretty much decided this is my life. This is where I'm living. I never thought I'd end up here, but it's okay. I'm getting good care. Quality people who care about me. And for example, a CNA came in this morning with a case of water for me because she comes in frequently and borrows the water. So they help me a lot, more than you know. I don't have a whole lot of major issues with them. The only thing is, when I first found out how many of them were having their hours cut, as long as losing their Medicaid, their insurance, I was very, very upset about it. Because with that being all cut back, it affects us tremendously. I never knew from day to day who I was going to have, who was going to come in and help me. The regulars were not coming anymore. So we would get people from the pool who would come in, but I don't even remember who they were. And they didn't know my medications. They didn't know how to care for me. So there was a lot of teaching going on. But that's okay. We made it through. We're on to a new year. And I actually have, our recreation department has pretty much fallen apart. We're getting a new director, though, starting the beginning of March. And the one person from rec that we have is on medical leave. So I've been taking over, doing a lot of the programs, but I've enjoyed it. That's okay. It's good for me to get my feet wet and get in there to help the residents. The other thing is, our staffing has become abominable. To be honest with you, there's just 3 3.0 per 112 residents. For 12 residents, 3.0 people. Right?
Martha? Oh, there you go.
Yes. 2.7 today, and hopefully they're going to hire new people. But the hard part is getting the new people to stay. They don't want to stay because they're not getting the support that they need. And they're not getting financially compensated at all. They're here for just a short amount of time. They come and go. And that's the hard part. You start to trust people, and then that doesn't work anymore. And you don't know who's going to be in that day. That's the very hard part. I've had many days crying, dealing with this. When the staff I love and whom come in on a regular basis to care for me, and I find out they've quit because they've had to take on other jobs to compensate for the hours that were cut down. I will say this though, Patrick, the administrator, and Christina, director of nurses, has really worked hard. They both worked very hard to try to pull this place together. I don't care much for the one who's over in the other building though, who's the director of administration. I've written several letters to him about my concerns for what's going on here. And he has responded 2 times. And in one of those responses was not a very happy one. And I hear he's a nice person, but nice does not make me stay alive. I need to be invested in. He needs to know what's going on here. And I don't think he gets it. And I've written that back to him. I said to him, don't placate me with your benign words that have no meaning. Kind of harsh, but that's okay. Never even met the guy. He should come over here and talk to me. He doesn't though, but he should. I write constantly to the kitchen because the food has declined tremendously with their budget cuts and their staffing cuts. And he's very responsive to me, though I will say that. I praise him when a good meal comes through. That affects our health tremendously and our healing. I'm in a wheelchair, and I have been for years. And I don't know. I've been very sad a lot dealing with this issue of the staffing. Because I just see how much it's burning the rest of the staff out. They're doing the best they can, the ones who continue to come back. Sometimes I wonder, why do they come back? Because they're very committed to their jobs and to their residents. But there's such a turnover. To see people that you don't know a lot. They're not picking from the pool anymore. So that's good. But we need more staff, for sure. A lot more staff. Is there anything else you want to say?
I just want to take this opportunity to say thank you to you for being here today and sharing your experience. You know, there's nothing more valuable than hearing from residents as to what's really going on in the nursing homes. So I really want to thank you for taking the time. And secondly, continue to write those letters to the administrators, because the reality You're a resident, right? That's your home, and he or she should be responsive to you. So don't ever feel that you're doing anything wrong. It's your total right to expect answers when you're writing those letters. So if you could stay with us, we would love it because my colleagues may have some questions for you at the end. And again, I want to take the opportunity to say thank you for being with us today.
Okay, thank you.
Next up is Rob Burrell. Rob is the president of the New England Healthcare Unions, District 1199, and we have worked closely with Rob and 1199 for over 2 years now. We worked with them before that, but mostly in the pandemic, we were having meetings weekly. So thank you, Rob, for being here today.
And thank you, Representative Abercrombie, Senator Moore, and members of the Human Services Committee. Good morning to all of you. As the representative said, we represent about 6,000 nursing home workers across the state of Connecticut and about 29,000 healthcare workers overall, including the staff at Touchpoints, the folks who Martha was talking about, the wonderful people that take care of her. And I think that the comments that Martha laid out really are important to frame our understanding about where nursing home workers are at. We applaud and we recognize and we thank the leadership showed by both the governor and you, all of you in the legislature who appropriated about $160 million for nursing homes in the last calendar year. It helped to stop some amount of hemorrhaging that was taking place at the time. And what I would say is that, things are even worse, frankly, than many of us believed, okay, in leadership at the union and in terms of our rank and file leadership and probably some of you. Omicron has absolutely, been, I think in many ways, the last straw for a lot of healthcare workers, from nurses to nurses' aides to housekeepers, laundry workers, dietary workers, recreation workers, you name it. Members of our union in nursing homes have been sickened physically. They are sickened spiritually. They are drained emotionally. Thousands of our members have become sick. Dozens of them have died. We have many COVID long haulers. People have been out of work in some cases for over a year because of the virus. And although the funding increases were needed and significant, in the environment that we're in, where wages are increasing across the board, and nursing homes continue to be one of the most dangerous places to work in the COVID-19 environment. Staffing has absolutely cratered. Okay, what Martha is saying is absolutely true. It is almost impossible to bring nurses' aides in the door at $17 an hour, which, after all, it's $34,000 a year. And so in this privately operated but publicly funded program, as you all know, the Medicaid dollars fund the work that nursing home workers do and the care that they provide to their residents. Providing for adequate staffing is one of the most important things that we need to be looking towards. The understaffing is chronic in nursing homes. Many operators, because of the payments that are being made to temp agencies, workers are literally leaving nursing homes to pick up jobs in temp agencies where they work at the same place but have doubled or sometimes tripled or quadrupled their wages. Nursing homes continue to be a critical part of our long-term care system in Connecticut, particularly for the chronically ill. And there are, I think, some things that we can do which become very, very important. The federal government is offering an enhanced Medicaid match that has been in place for the past couple of years. It's a 10% increase. Connecticut can get that extended, I believe, through the fall of this year, but currently that funding expires in April. So that is money that the federal government can subsidize the care that people need and that operators need to provide staff. And that, I think, is an absolutely urgent need. The funding to be able to continue to invest in long-term care over the long haul becomes very, very important. We need transparency so that there's financial accountability and making sure that Money is going towards caregiver worker wages and benefits. But there are capital needs that need to be addressed in some of these facilities as well. That is just a reality. 1199 has dealt with some apprenticeship programs for CNAs successfully with Genesis, which is a major operator in Connecticut with about 15 facilities. We work with the Department of Labor on that program. And so I think there may be opportunities to increase that program with some degree of support from the state. But I think, again, the urgency of what the needs are in the facilities, where on a normal shift, you have a ratio of 1 nurse's aide to about 8 residents. In many homes, you might find, 1 to 20, 1 to 25, sometimes even 1 to 30 if there are call outs and they can't fill those shifts. So I just think that one of the things that we have that is a unique opportunity is that in most years, Connecticut truly is in a precarious place fiscally. We're fortunate now to have unspent ARPA funds, a tremendous projected budget surplus, a rainy day fund that is at its max. And we need to think in terms of solutions that are not Band-Aids, but that actually meet the needs of Connecticut's working people, white, Black, and brown, and particularly the residents that are cared for in our nursing homes, who deserve the best in terms of staffing and care. I thank you for the time.
Thank you, Rob. We appreciate it. We've been joined by Senator Berthel. Senator, would you like to say any opening remarks?
Yes, good morning. Sorry for that. I'm on 2 different calls at the same time and trying to manage a phone and this. So good morning and thank you, Representative, for the opportunity just to say hello. I've been listening, again, 2 different calls at the same time, but I think we're obtaining some good information here in terms of, kind of historically what has happened and perhaps to identify some opportunities to make some good changes going forward. So I have another call. I'm gonna have to jump off at some point because I'm missing a 3rd call that I need to be on. But thank you for, I know, right, Senator Moore, I see you laughing. It's just 'tis the season, and I just expressed to another colleague in a text message that I can't stand this anymore with all these Zoom calls at once. It'd be so much nicer when we get back in the building. But thank you, Madam Chair, for a moment to say hello, and thank you to everyone who's here and sharing your concerns this morning.
Thank you, Senator. Thank you for being here. And you're right, we're pulled in all different directions, but I'm sure everyone here appreciates you taking the time to listen to what's going on in the human services nursing home arena. So thank you so much for being here.
Thank you.
Next up, we have Michelle Brown, and I hope I say the second name right, Lakita Shipman, who are workers of 1199 and what we like to call the boots to the ground. And before you start, I really want to say thank you to both of you for what you have done to really protect our most vulnerable population, which is our residents in nursing homes. So thank you for being here today, and thank you for sharing your stories with us. And whomever wants to start, please proceed.
Yeah, good morning, Senator Moore, Representative Abercrombie, and members of the committee. My name is Michelle McKenzie, and I'm a certified CNA at St. Mary's Home in West Hartford. I come here before you today to share the perspective as someone who has worked in a nursing home for 33 years, and to ask you to please use your power as a legislator to address the critical issues that exist in the nursing home across the state. As I mentioned, I have worked for 33 years as a CNA at St. Mary's Home. And for the last 13 years, I have worked on their rehab unit. I love the residents I care for, and it's truly given me the joy, care for them to help them recover. As a CNA, I am responsible for many tasks, including bathing, changing and feeding residents on my unit. We have residents who are needed extensive care, some lacking the ability to even brush their teeth. It has been a pleasure to care for my resident. However, as the staffing crisis have worsened over the years, it has become harder and harder to provide the level of care they deserve. I often care for 14 to 15 residents all on my own. To put this in perspective, I must bathe, change, and feed 14 individuals on my own. What happens if an incontinent resident has an accident? I cannot attend to them right away. They must lie in their own poo and pee until I can get to them. More and more, I'm finding I cannot keep up with all my tasks at work, despite not taking any breaks or running myself ragged my entire shift. Simply put, there is no way a CNA can care for 14 or 15 residents and provide the level of care for those residents deserve. A CNA should never have more than 8 residents they are caring for. Another challenge we face is the cover expanded nature of our work. Nursing homes are no longer places where only elderly receive end of life care. Now we are caring for individuals with psychiatric condition, substance addiction daily. I am beat up by residents as I attend to them. I do not blame the residents. I know this is the symptoms of their condition. However, the fact remains my coworkers are constantly being asked to do more for less. To address these challenges, we need more staff. We cannot be exposed to provide quality care with the staffing level we have. I understand nursing homes are struggling to find people who want to do this work, but that is because the wages are so poor. Why would you subject yourself to working conditions in a nursing home for $16 an hour when you can do an easier job, earn $20 an hour? Sadly, it would appear that nursing home operators like Trinity would rather take advantage of the good nature of my coworkers and then pay us a living wages. Personally, I had enough and will be leaving St. Mary home in the coming year. At my age, I cannot continue subject myself to these working conditions, earn such minimal pay. This is my life work and it breaks my heart that I can no longer do it, but I am not alone in feeling this way. If aggressive steps are not taken by the legislatures and the state to address understaffing in homes like mine, there will be no one left willing to do this work. Please do what is right, both nursing home workers and the resident they care for, and take action to address this critical understaffing in nursing homes. Thank you for your time.
Thank you, Michelle. Thank you for sharing. We really do appreciate it. And, you know, we understand that it's been very challenging and the workforce right now is very challenging, and it's something that we are really trying to address. I don't think there's one solution, but we are aware of the challenges that you're facing. So thank you for sharing with us. Is Lakita also with you?
Yes.
Good morning.
Good morning. Good morning, Senator Moore, Representative Abercrombie, and members of the committee. My name is Lakita Shipman. I am a licensed practical nurse at the New Haven Center for Nursing and Rehabilitation. I've come before you today to testify on the intense need for Connecticut to invest in our nursing homes across the state in order to ensure quality care for residents and safe working conditions for healthcare workers. I have worked at the Center for Nursing and Rehab for 12 years. I started as a CNA, but have been an LPN since 2016. As an LPN, I am responsible for a number of tasks, such as administering medications, providing quality care and wound care per order. I love the work I do because I enjoy helping people and seeing the care I provide have a positive impact on my residents. I've been able to develop close relationships with my residents and truly love watching them recover. With that said, my job is incredibly difficult and demanding. Understaffing is a huge issue in my facility. On an average shift, an LPN at my facility would care for 26 to 30 residents. When there is inclement weather like we've recently had, the ratio can balloon to 60 residents per LPN. This is not an unrealistic workload for an LPN, but it's not fair to our residents. What happens when I cannot pass meds or provide care to the residents in a timely manner because I have 60 residents to care for? The residents suffer, and it's my job on the line, even though I'm not the one responsible for the insufficient staffing. Understaffing also has a negative effect on staff morale and oftentimes result in burnout. One driving force behind this is mandated overtime. You never know when you're going in for an 8-hour shift if you would get mandated and end up working a 16-hour shift. We end up with overworked nurses staffing units, which ultimately impacts the quality of care that residents receive. As a professional caregiver, it is very difficult for me to work knowing my coworkers and I aren't given the care our residents deserve. Another byproduct of mandated overtime is additional call-outs. Let's say your daughter is being recognized at school for making an honor roll and you're scheduled to work that morning. Even though your daughter's ceremony isn't until the evening, you may consider calling out because you don't know if you will be mandated to stay. Now you're deciding between being present in your child's life or doing your job. These are difficult decisions for professional caregivers to make, especially because we care so deeply for our residents. And this directly stems from chronic understaffing in nursing homes. These issues will continue so long as the state continues to underfund nursing homes and continue to allow nursing home operators to put profit before people. Nursing homes like mine need more staff and higher wages for those staff. Instead of one LPN caring for 30 to 60 residents, we need one LPN caring for 15 residents. We need to have enough staff so that 1 or 2 call-outs does not send our entire facility into crisis mode. We need to have the confidence that when we are scheduled to work 8 hours, we will not be mandated to stay longer, pulling us away from our families and other life obligations. My co-workers and I love our residents and love caring for them. When you love someone, who fight for them? This is why I am here today. It is time for the legislature and state of Connecticut to show that they too love my residents by taking the steps to address the issues in nursing homes so my residents can receive the care they deserve. Thank you for your time.
Thank you, Lakita, and thank you for sharing with us. We really do appreciate it. And, salaries is always an ongoing issue. We have done we've made some advances in the past, but you're absolutely right. It's not where it needs to be. So thank you again for sharing with us. We really do appreciate it. Up next, we have Ann Spinard, and Ann is the Chief Clinical Officer for the National Healthcare Association. Good morning, Ann. Thank you for being here.
Good morning, Representative Abercrombie and Senator Moore and the members of the Human Services Committee. My name is Ann Spinard, and I am the Chief Clinical Officer at National Healthcare Associates. National has been providing nursing home care in Connecticut since 1984, with its opening of Riverside Health and Rehabilitation, and now provides skilled nursing and rehabilitation services across Connecticut in 13 communities. In Bethel, Bloomfield, Fairfield, West Hartford, Rocky Hill, Marlborough, and Milford, Wallingford, East Hartford, Bristol, New Milford, and Middletown. National has over 1,780 FTEs in employees who work in 13 nursing homes. We are licensed to provide services in 2,054 beds, and for decades have been a member of the Connecticut Association for Healthcare Facilities. So here we are approaching 2-year mark of the COVID-19 pandemic and a public health emergency. And I can say that our nursing homes, the residents we serve, and our employees have been challenged like in no other time in our history of providing services. In our 13 nursing homes, we were specifically and severely impacted from the onset of the pandemic. Its various surges and variants, including the most recent Omicron variant, which is responsible for outbreaks in nearly every Connecticut nursing home and other congregate living centers. I can easily say that our residents and staff have experienced and dealt with nearly every feature of the pandemic from the very beginning, when the misunderstood virus was spreading through persons showing no symptoms, and especially in regions of Connecticut experiencing high community prevalence. We experienced firsthand the consequences of lack of COVID-19 testing capacity in the United States and here in Connecticut, the extreme shortage of PPE, and the ever-changing CDC, CMS, and DPH guidance policies that evolved as the virus became better understood in the medical, academic, and scientific communities. As a company, National spared no expense and left no stone unturned to find and purchase PPE, testing supplies, and staffing. I can attest to that. I spent many of an hour working with our team to do whatever we needed to do to make sure that our staff was protected. Through these efforts, our staff had what they needed to safely care for our residents. We experienced the severe and emotionally devastating visitor restrictions imposed early in the pandemic, and we have experienced the optimism of what COVID-19 vaccines means to our community. While the trauma our residents and caretakers faced was extraordinary, I can say that their resilience and determination was equally extraordinary. With these introductory comments, I'm happy to focus on the remaining remarks on the topics of our severe staffing shortages and how this issue is interrupting our hospital admissions and how this is slowing down the occupancy increase that would be otherwise experienced at National. Second, and this is also related to our staffing shortage, I can offer observation on COVID-19 staff booster mandates and the approaching February 11, 2022 compliance date, and the significant concerns we have about the staff layoffs/furloughs that could happen next week, and how this will make the staffing shortage issue so much more severe. And again, related to staffing, I would like to give you our comments on the negative impact nursing staffing agencies are having in our nursing homes. And finally, I would like to also offer comments on the recent Connecticut mandate requiring nursing home visitors to be fully vaccinated and boosted if eligible, or otherwise produce a negative test or take the test on site at the nursing home. Of course, I'm happy to answer any questions at the end. The staffing shortage our nursing homes are experiencing are like no other in our 30+ years of providing skilled nursing services. With the initial onset of COVID-19, our centers lost some staff to early retirement and those just afraid to work in healthcare during a pandemic. Then we had the increase in extended unemployment benefits, which delayed staff from coming back to work. As the pandemic continues, staff are burnt out and they're exhausted and are choosing to continue to leave healthcare. Others are leaving regular employment to work for agencies where there is plenty of work at a much higher rate of pay, basically, and name your own schedule. The staffing shortages are so significant that nearly all of our national facilities have limited admissions from hospitals to be able to safely address the care needs of all our residents. In some of our centers, we temporarily closed a unit to consolidate the staff to safely care for our residents. The stress on the current staff is enormous as we struggle to fully staff our centers. Consequently, the occupancy in our buildings is much lower than normal, but the lower number is really a distortion caused by staffing shortages and how it impacts admissions. It's not at all a true reflection of the need or demand of our services, but is a reality. We fully expect to improve over time as staffing situations improve, but we are concerned that this will be a slow process, even perhaps years, as our country recovers from the pandemic. The 4.5% wage enhancement and new pension and healthcare dollars that were appropriated last session is critical to us being able to attract people to our centers and help keep them incentivized to stay employed. Without this investment, it would be almost impossible to attract and hire staff. While we and looking at now the boosters, while we achieved 100% compliance with vaccination, unfortunately, we have had a much more challenging time with the boosters. This is consistent with what our colleagues are experiencing across healthcare spectrum, and the reasons are diverse and complex. But whatever the reasons, we are very concerned that with the executive order mandate deadline approaching for February 11, 2022, we are going to have to again either lay off or furlough employees from an already depleted supply of staff, unless an extension is granted. Our nursing homes have been very negatively impacted by the staffing shortage in so many ways, but the impact of having to turn to nursing staffing agencies has been particularly troublesome. Using staffing agencies is a measure of last resort in our company. From a patient care perspective, it runs counter to the consistent assignment of staff to our residents, and that has been our longstanding practice. Agency staff employees lack the commitment to the residents that a full-time employee demonstrates. Agencies, by their very nature, are gig workers and have no allegiance or commitment to the nursing home, their residents, or employees. However, like so many other nursing homes, we've had to utilize this option. The financial consequences have been enormous. We are seeing unbelievable spikes in the cost of staffing agencies. In the current environment, it's like a bidding war for staff that is going on unrestricted. The agencies, therefore, keep raising their pay unrestricted and passing the cost along to facilities who can't compete because we can't pass on those costs. This further demoralizes our employees who show great commitment and are working alongside people who show no commitment and are making more money than the employed staff. This bidding war for staff is not only at the agency level, but also trickling down to employers who are trying to outbid each other for permanent staff. Those costs may be unsustainable. We understand the Connecticut Attorney General is reviewing these practices and that the state legislature is also reviewing this issue, and we greatly appreciate that. As far as the changes in the visitation, the recent changes in visitation rules related to vaccination/boosters and negative test conditions have again forced us to pivot. The sign-in process to come in and visit has lengthened, and on occasion we have encountered visitors frustrated and angry over the process. But in general, most visitors are patient and kind with the new process and appreciate their loved ones being protected. Thank you again for inviting me to speak on our past and current experiences during this unprecedented public health emergency, and I'd be happy to answer any questions you may have.
Thank you, Ann. We really appreciate that detailed information. I think that's really helpful for everyone that's on this Zoom today. And hopefully you can stay around also, just in case anyone has any questions for you. So thank you. Up next is Patricia Morris, who is the president and CEO of Connecticut Baptist Home, and fondly known as Patty to me, because the Baptist Home is here in Meriden. And thank you for being here, and thank you for what you do, Patty.
Good morning. It's my pleasure. Representative Abercrombie, Senator Moore, and members of the Human Services Committee, as well as to my fellow panelists. As Kathy said, my name's Patty Morse. I serve Connecticut Baptist Homes as their president and CEO. We're a not-for-profit organization that provides a continuum of aging services, including 2 not-for-profit nursing facilities, one located on a campus in Meriden, another located on a campus out in Brooklyn, Connecticut. I'm here on behalf of Leading Age Connecticut, a membership association representing nonprofit aging service and housing providers across the state. And I want to thank you for allowing us to participate this morning in this forum. We want to thank you for your support of long-term services and supports throughout the pandemic and in the biennial budget adopted by the legislature this spring. To begin with, I'm going to briefly review the status of the nursing home sector currently. I personally have been in the aging services field for over 40 years. I've worked in various roles, departments, positions, and different types of locations and facilities. And I can tell you these past 2 years have been unlike any other I've experienced. But it has been 2 years, and we are now striving to get back to what we hopefully will call the new normal. Nursing home visitation is wide open and has been for some time now under the rules of the federal regulatory agency CMS, and we have implemented the governor's executive order, which requires visitors to be either up to date on their COVID-19 vaccinations and boosters, have proof of vaccination, or a negative test. And if they don't have that, we can provide a test that has been given to us to provide by the state of Connecticut. Our staff is fully vaccinated in accordance with the state's previous mandate. The state has since mandated under Executive Order 14B that our staff, which also includes all of our vendors and contractors, that they receive their booster by February 11th, which I don't need to remind you is only 3 days away. While we fully support complete vaccination of all of our staff and residents, unfortunately, and unlike the original vaccination requirement, we are finding it more difficult to achieve full compliance with the staff booster mandate due to staff hesitancy in receiving this booster. Despite our unrelenting efforts, we have not been able to achieve 100% compliance. We are fearful that there is an impending staffing cliff on September 11th, and if a significant number of employees continue to resist compliance, despite our efforts with more education, we'll be in a position to furlough those staff. Running an organization with fewer than 150 employees in each of our campuses is manageable, but when you have an organization with thousands of employees or a campus with hundreds of employees, it's much more difficult. If you have 600 employees and 10% are not boosted, you stand to lose 60 employees on Friday. We're already at very, very critical staffing levels. Not all of us can access agency, even despite their high prices. They're just not available to us. I think it's a very important thing to note as we talk about the staffing crisis and the impact of that today. Resident occupancy has not returned to pre-pandemic levels in many nursing facilities, due in part to the staffing crisis, and Ann already addressed that. We're not able to fill beds, free up hospital beds if we don't have staff to provide the quality care that we demand when we admit those people into our care. We've achieved a high level of competence at controlling these outbreaks. We've gotten really good at managing COVID and positive cases among our staff and our residents. And I want to reassure you that we're at that point. We currently have the PPE that we need. We have the testing materials that we need. Our staff is continuously trained on infection control practices and things that change day to day and week to week. And all of these are now determined to be effective in controlling and preventing this virus from spreading. Regarding the use of the investment in aging services that was contained in the biennial budget, the cost of managing both the pandemic and the staffing crisis continues to place a heavy burden on our sector. This is why we're greatly appreciative of the investments in nursing homes and all of aging services that are contained in the state budget that was passed this last session. I want to assure you that the nursing home funding is being invested back into the staff and resident services, including the 4.5% nursing home rate increases in each of the 2 years of the 2-year budget that's to be used for wages for our employees. We're very pleased to see that there are additional investments proposed by DSS to be made into a new acuity rate system for nursing homes that will be phased in over the next 3 years. The proposed rate system will finally address our concern that many nursing homes that have invested year after year in their physical plant, staff, and services do not have Medicaid rates that cover those costs. In this new rate system, the administration is proposing a true rebasing of rates. This will greatly benefit many not-for-profit facilities, and we're hopeful the legislature will support it. We're no longer receiving the financial support for testing from the state for our staff and for our residents, but we do receive test kits for our visitors, for which we are grateful. And we were granted a 10% temporary increase for 9 months, which has now been extended an additional 3 months through the end of June. Something that is greatly appreciated as we continue to face the costs of both the pandemic and the workforce crisis. As we look at the workforce crisis, we must address this issue in the healthcare sector. It is both a state and a national issue, and it's truly reached a critical level. A multifaceted approach is going to be needed to address it, including financial support to address the immediate need, incentivize our staff to continue to remain in their roles, and encourage trained individuals to return to the healthcare sector. We're concerned about the exploitative practices of temporary staffing agencies. If staff are available, they're at prices that are exorbitant and we can't afford. We need to expand education and training opportunities and make them accessible and affordable. We need to elevate partnerships between the healthcare sector and Connecticut's economic development and workforce officials. Simple things like making it easier to obtain a fingerprint scan in order to get your required background checks done. I have people that really don't have transportation, haven't driven to Hartford, that now have to drive to Hartford to get fingerprints taken to comply with the request because the Middletown office is not open to us. We'd like to explore the idea of a public relations campaign to entice individuals who may have a passion for working with older people to come and consider work in the aging services field. Finally, our vision for the future of aging services. We know we need a balanced continuum of long-term services and supports, that nursing homes are a critical part of that continuum. Our buildings are aging. We need to continue to address the physical plant issues, and we know we must assess the supply of beds that are available in the state. That is why one of the conditions of our taking the additional funding this pandemic was that nursing homes will need to submit a plan to DSS by April 1st that takes into consideration efficiency, quality of care, and the possibility of consolidation of facilities. The review of these plans will include consideration of the need for nursing home beds within a 15-mile radius of each of our facilities. We will need to start acting on the plan within 3 months of its approval. We view this effort to initiate planning on a statewide level as an opportunity to build for the future, including a chance to evaluate the infrastructure investment dollars needed to improve, upgrade, and modernize the nursing homes that will be needed as we move forward. I'd like to thank you for this opportunity to provide you with an insight into the current operations of our nursing home membership, and I'm happy to answer any questions that you might have.
Thank you, Patty, and thank you for all you do. I think the best way to describe the situation we're in right now is we always thought that the workforce for nursing homes was fragile. Now it's broken. And I'm not sure where we go from here, to be honest with you. I can tell you that there's been a lot of work behind the scenes with DECD and the Workforce Strategy Board looking at this issue. But I think I think the challenge is that we have to think of it long term, and that's where it's going to become very challenging. Representative Hughes, we're going to wait until the end. We have one more speaker, and then you can be first to comment. With that, I'd like to welcome Lorette. I'm going to say it's Kier is her last name. I hope I said it right. She's a nursing home resident and a family member advocate. Thank you, Lorette, for being here.
Good morning. Can you hear me? Okay. Thank you for having me. Good morning, Senator Moore, Representative Abercrombie, and members of the House Human Services Committee. I'm a family caregiver. I'm here on behalf of Connecticut Caregivers for Compromise and 911 Nursing Home, a small action-oriented group of families who represent all districts. I'd like to recognize all that was accomplished in 2021, and I'd like to express my gratitude and the appreciation of our group. Particularly, we'd like to thank Marie Panter and her team for the dedication to all that has been accomplished, and we know that so much more needs to happen on behalf of people living in care. I was so appreciative to hear Lakita and the great women of St. Mary's talk about what's happening with staffing shortages and how that's impacting residents. Ann Spinard echoed those sentiments, and we really need to hear and heed what's happening. For myself, my mother-in-law passed in care a year ago. She had Lewy body dementia, and she died alone, terrified, and unable to feed herself. She had no idea why we had left her. This was a beloved woman with 14 grandchildren and 6 children less than a mile away. That didn't need to happen. Connecticut Caregivers for Compromise and Connecticut 911, we are here to lend our support, lend an ear to the people that need it and that cannot do this for themselves. I'd like to make a plea for continued support of long-term care staffing from the good people in Hartford. I'd like to ask for the expansion of the long-term care ombudsman program. They're at their max, and they need to do so much, and we need them so much. I'd like to, most importantly, ask the Human Services Committee members to take action to expedite the role of PA 21-71, which was signed into law June 24th of last year. And we're still not sure what's happening with that. That's not quite in place and getting full implementation. We have family members that have worked with the Department of Public Health for over a year on this essential support person law, signed into law over 7 months ago. The policy and procedures in the essential support person for the essential support person remains on the shelf. Connecticut has taken an active role in supporting the federal essential caregiver bill, HR 3, and can be proud of the fact that the bill is signed by Representative Larson, Courtney, and DeLauro. However, our state law 2171 remains inactive. Families are waiting. Our loved ones can't wait. My mother-in-law has been gone a year this month, and the caregivers today have no guarantee that if a spike happens or there's some change, that they'll be allowed in to give their loved ones the basic daily care they need. And we know that this would really, really go a long way because of these horrific staffing shortages. It's more critical than ever. Thank you for doing this work on behalf of Connecticut families and for the people waiting for a glass of water, to use the bathroom, and to be fed. You are their voice. We appreciate your willingness to raise it. In closing, I'd like to say that I've seen so many dedicated people here this morning, and we're all pulling for the same things and to meet the same ends, and that is a better day in care for people who need our support. If we could remove these impediments to care through these laws and to support this legislation, I implore you, people in the position to make a change, to continue to do so. Thank you so much for all you do. We greatly appreciate it.
Thank you, Lorette, and thank you for being here. We truly appreciate it.
Thank you
And
for
thank
having
you
me.
to all of the presenters that have been here today. Your willingness to just talk about what's really going on in the nursing homes is really appreciated. And it's not only for the members of the Human Services Committee, but we are live on YouTube, and there are a lot of people in the public that are watching this. So it's great to have you here, and we really do appreciate everything you've done. Senator Moore, we'll start with you as the co-chair, and then Representative Hughes, we will move on to you.
Thank you so much. I appreciate all of you all and the information that you've provided. What I thought was really great, and I think this is probably due to Kathy, Representative Abercrombie, helping organize this, that we had great representation from the client, the unions, the workers, and the providers. So I thank all of you all. I do have a question for Rob regarding the $17 an hour. Is that entry level, the $17?
Rob, are you still with us?
If not, I'll go on.
There was somebody, Senator, there was somebody from 1199. I'm sorry, we don't have your name, sir. Can you introduce yourself?
Sure. My name is Jesse Martin. I'm the Vice President of Nursing Homes and Hospitals for 1199. And I stayed on to answer questions on behalf of Rob. So my apologies for popping in and waving my hand. Hi, Senator. How are you?
Hi, good. Thank you. So I had a question about the $17 an hour.
Yeah. So because of the lack of funding and really consistent funding in the nursing home industry, $17 is around the starting wage of a significant number of CNAs throughout the state. But we find that because of the lack of raises over the last decade, that actually a lot of long-term staff CNAs are also making that. So even in the most progressive best union contracts, we see that a lot of the CNAs we represent from with as much as 5 to 6 years worth of experience are just now getting to that $17 an hour range. Whereas if they leave their job at the facility and go work at one of these staffing agencies, we have members that have actually left their job at the facility, continue to work in the same facility, but with a staffing agency, and make as much as $35 to $40 an hour for a CNA.
Thank you for that clarification. I want people to understand that 17 sounds good to some, not to me, but there are people who've been sitting there a long time doing that work who are not being compensated. They didn't see the growth of being there for longevity. So thank you. And then the other, Ann talked about the staffing shortages, and we're hearing that in many places, but I'd like to hear what people may think besides pay. I think some of it is the training. What are some of the solutions that you could come up with to try and increase people not only to come in, but to stay? And I know the last speaker said expand the education, but are we working toward that? I mean, not for the state, but the providers, are you working toward trying to build something within your organizations that would encourage people not only to come in, but to come in and know that there's some growth? I know there was an LPN on earlier, so to go in as a CNA and see that there's a trajectory that I could go to an LPN or I could go to an RN with the support of the organization. Is that taking place? And I would direct that to Patricia or to Ann.
So this is Ann Spinard. If I could make a couple of comments, Senator Moore. Yes, we are collectively, especially in the state of Connecticut, working very hard. I sit on a committee with a lot of other state reps and whatnot. We worked on a demonstration project that was with the Connecticut Center for Nursing Workforce with Marsha Proto to take CNAs or people that wanted to be CNAs, and they came through, and we did a combination of a lot of on-site clinical application, and then was supported with some online education. It was a demonstration. We're working and are supporting other initiatives. But collectively as a company, what we've done at National is we're certainly have looked at and graded wages. We've, for people who are going to school and have federal loans, we're doing a buyback on the loans, so helping to make it affordable, and supporting with staffing where we can be supportive, allowing people to keep changing their schedule depending on their class schedule so they can get their clinicals in. We support in many of our centers allowing schools to come in and be clinical sites. So both for LPN programs and for RN, and that's really important, especially since we have a lot of high acuity, especially in our subacute units. So it's almost like med surg experience for the RNs and the LPNs to have in our centers. And we're supporting that seamless progression. So from CNA to LPN to RN or CNA to RN, whatever it is. But the other thing that we've done is trying to look at how do we get CNAs in? So right now we have just a supply of CNAs, right? And everyone's trying to grab them. So we've taken advantage and in support of with Connecticut, taking in what we call unit helpers. We bring people in who have interest in working in our in senior services, and we bring them in and they start just doing simple support things on the unit, from visits to making sure everyone has water, to answering call lights, because 60% of the time the resident just can't reach something and they just need help. And then we work with them, paying them the whole time. And then we've been putting them through the temporary nurse aid program, which is allowed. It's an 8-hour online program. And then we put them through a very aggressive education program to obtain the skills. And then as soon as we can slot them into a CNA program, we're funding it, paying them to work, paying them to go to school, and paying for the program to have them become CNAs and to become certified. And so it's a career path for someone who doesn't have the funds to go out and spend $2,000 or $2,500 to become a CNA. And we're not the only company doing that piece of it. You can see most of the centers are doing something like that. So we're taking people who have any kind of interest and then bringing them along. And if I could lastly, one other thing, I think we have to take an opportunity to support care of the older adult. We're an aging population, and whatever center, whether it be home care, nursing home, or anything in between, we need to make sure that we are getting to the young people, so into our high schools, and showing the value of the care of the older adult. It's a very rich environment, and it's something that I'm incredibly passionate. I've spent my 39 years in nursing, all of it within senior services. And so those are just some of the things that we need to do. And I think it's multifaceted, and no one person has all the answers. So hopefully I've addressed some of your questions.
Well, I want to thank you, because we don't often hear about that part of it, right? We hear about the low wages and the amount of work, but I mean, anytime there's an opportunity for people to come in as an entry level, to know that there's a plan for me to go through, and also some help to get me there, would help increase. I also want to say that I think there really should be a statewide campaign addressing this, and talking about the things that you mentioned, and that people may not know about, right? To get more people involved and to think about coming into it. As you said, an aging population, we are going to be the majority, and who's going to take care of us? We can't continue to take care of everybody else. So I want to thank you. And, I think that's one of the things we should think about collectively. What can we do, both from the state, from the worker, from the provider, from the union? What can we do to promote this job and build it to a place where people will want to do it, but also have in place what we need to have to support them, to go to school, to pay for some of the things that they need to be able to lift themselves out of poverty, because I think $17 is a poverty wage. My opinion. I thought it should be 21 for everyone. That was my song that I was singing. So thank you. I'm happy to hear that we have some positive things that we've done during COVID. I think COVID did good and bad for us. I mean, people lost their lives. They put us through a lot of stress, but it also amplified and identified a lot of things that we had not done as a state for workers, for nursing homes, and that we put things in place. I was really happy to hear that the investments that we've made have helped us. So when Omicron showed up, we had things in place that we could begin to address and not be where we were in April of 2019. So thank you, Representative Abercrombie. Go ahead, listen.
If I could make two more very quick comments. One is in Connecticut, we have the nursing workforce data, which has been an investment and that the government has made. We should definitely be looking not only at the CNA worker, but the licensed workers. I'm part of that group that's aging in nursing, and we're not going to have enough nurses. We're physically not going to have enough nurses, and I implore everyone to look at that data, those data, and work, and collectively in the state we have to work on this. About half of our students who are educated here in Connecticut leave Connecticut. So that's just one last thing. And if one other comment, Senator Moore, we've been talking internally, this $17 an hour definitely was a big jump from 12 that it was for so long. But when the minimum wage goes to 15, 17 is nothing. So when minimum wage goes to 15, why do you want to work with the hard work that our CNAs do for 17? So we're really going to have to, think as collectively, how are we going to bridge that? Because in other states that's happened, if you can get $18 an hour or $21 go into work for Amazon, why would you spend the compassion and care that you need to do to care for another human being? I just put that out.
Thank you. Thank you, Representative Abercrombie.
Patty, you're welcome, Senator Moore. Patty, did you want to add anything to that?
You know what? I'm just going to add a couple of things. Ann mentioned a lot of things that a number of providers are doing. One of the things that we've been pretty successful with is partnering with our high schools, many of which have certified nursing assistant programs that they offer to sophomores and juniors in high schools. And we created an internship program where after they're certified, they can come and work with us as interns. They make the same wage, but they don't have a full caseload of clients to care for. They partner with one of our nursing assistants so that we're able to train them at 17 and 18. Other people will hire them, but they're really not ready to take care of 5 or 6 or 7 or 8 of our older people. The other thing we did is we've split some of our shifts. We took a 3 to 11 FTE and created 2 4 to 8 positions. So we have 2 CNAs working that, high school kids working the 4 to 8, because you don't want them working past 8. And then they work every other weekend, which is one of our biggest staffing burdens and challenges, is covering the weekends. So we give high school kids a part-time job, some great experience, an opportunity to get exposed to aging services. We started this program about 16 years ago. We still have nursing assistants that are with us that started as interns 17 years ago. Meriden has a pretty rich program as well as a technical school. We also should not just think about nursing assistants. I know that's a pain point for a lot of us as our nurses. It is just as hard to find a cook, people in the dietary services program, people to support housekeeping and laundry. So we've implemented training and education programs, growth opportunities to become a lead CNA, a lead dietary aide, a lead housekeeping aide, so that there is almost a career ladder. But again, there's got to be funding for those positions as well. We can care for people all day, but if we can't clean the building and can't provide quality food, that's only part of the solution for us. So I think partnerships with technical schools, growing certified nursing assistant programs in more of our high schools across the state would be a huge boost for all of us.
Thank you, Patty. Senator, any follow-up to that, or are you all set?
I'd like to hear the good news also, so thank you. I appreciate that. I just think we need to explore that more and share that information more with not just the among your organizations, but with us, but also so we could reach out to other organizations and talk about those opportunities also. So thank you.
Thank you. Representative Hughes, followed by Representative Case.
Thank you. Thank you to all the presenters. I work in a nursing home that is a clinical training setting with both technical schools, several of our universities on-ramping. But I do agree with what everybody said. We need a massive investment, sort of the way we are rolling out for advanced manufacturing, a trajectory that is really, really similar to a viable vocation and profession and certification, but we also need to invest in the safe work environment. And I'm really, really appreciative, Mairead, I thought you accurately painted the picture that we're in, and yet every consecutive speaker added to that picture, really creating an accurate depth of the situation that we face. And the workforce crisis is critical. One of the things the CNA and the LPN talked about was aggressive behavior of residents. And I want to lift that up. That is a direct result often of people with dementia, like the ones that I work with unfamiliar caregivers. They get aggressive because they don't have that connection. And I'm thinking that we really need to value workers, not just because of the longevity and experience, but because of the relationships of trust that they have developed with their residents that leads to good outcomes. If a caregiver understands and knows their resident, they can, approach them in a way that the residents, especially those with dementia, aren't, defensive in caregiving. They know how to do that. And when we don't have that kind of, consistency, then we create unsafe work environments for the resident and for the staff. So we need to sort of value this, this connection and relationship and trust with people, even maybe more than we value just straight longevity and, seniority in traditional work environments. And we have to invest, like somebody said earlier, in the capital improvements and the these are aging facilities without good air quality, some of them, and all of these things now we know are so critical to keeping, again, both the workforce and the residents safe and healthy. And I think it's going to require a massive investment by the state, but also, by the federal, agencies that have oversight. And I'm so, I'm so moved by your advocacy on behalf of this industry, because I have a passion for it too. And I think it hasn't been raised until this pandemic of really how we need to invest in our aging population, wherever they are, wherever we are, because we're all aging. So thank you for showing up. And I do want to hope that Human Services or somebody can address the February 11th cliff that we're facing. I don't know exactly what the solution is, but I'm hoping that we can pull together some solutions to this crisis.
Thank you, Representative Hughes. Representative Case followed by Representative Cook, whose hand raising is not working, so I apologize for that. Representative Case?
Thank you, Madam Chair, and Rep. Hughes. Only some of us are aging, but that's okay. Hey, no, I appreciate everybody coming forward and being on the meeting. And I guess Patricia or Patty, I guess it is, we're under Representative Abercrombie. Some of the stuff you talked about and some of the things that concern me, and I'm getting emails on it. I guess people are watching this meeting. And there's also another meeting, and they're also talking that other meeting about the booster by the 11th, which is Friday. But my question to you is, you talked about 100% vaccinated by the 11th and the booster. And then you talk about testing. We've had a nursing home up in my way, 100% vaccinated, 30 outbreaks.
Mm-hmm.
What is the difference between a vaccinated and non-vaccinated, and you don't have to test the vaccinated when you have a home that's 100% vaccinated employees? And what we found out during, which Rep. Abercrombie and I worked for two summers now, is trying to get the pay increase to the CNAs and others so that they could work one job. because we know those people are leaving your facility and going to work their second job, but they're fully vaccinated. So tomorrow they can come back to your place and not get tested, but they could have a breakthrough because they were at somebody else's place. So my question is, what gives somebody, I mean, we're seeing all the breakthroughs everywhere. And when you do the booster by the 11th, it takes 2 weeks for it to be in place. So are those people fully vaccinated or do they have to test?
I think by definition, they're fully vaccinated. If you've had the series of 2 or the 1 Johnson & Johnson and the booster, you're fully vaccinated. I would tell you that 30% of our staff that have tested positive since December 22nd are vaccinated and boosted. We're seeing with the Omicron breakthrough with people that are boosted. We are not testing people that have tested positive, but we are testing, because we're in an outbreak, we are testing our staff who are vaccinated and boosted. Just for that reason, we're seeing those breakthrough cases. And the breakthroughs that we're seeing are staff reporting to work, we're testing them, getting a positive result, and they're completely asymptomatic. But I would reassure you, and I think Ann, who's a nurse, would probably address this as well. We've gotten really good at managing this. And our residents that have, the few that we had that were positive were really not sick. Their symptoms were mild. They were quarantined for that 14 days. They could have visitors if the families wanted to visit them, but nobody was really sick. And the same with our staff. So depending upon your staffing levels, your staff can come back as early as 5 days if they don't exhibit any symptoms. It's tough for us when we have 5 or 6 people that test positive that are out. And I think that's one of the other things that's impacting this booster deadline is we're still seeing staff, not as many as we did today. Our state level is down at about 4.8%, I think is our positivity rating. We're down under 5%. So we're seeing fewer staff test positive. But when when you have a nurse test positive, you're going to lose that person for 5 to 10 days, and they may be fully boosted. So,
and that's my point is I agree with you, because you stated earlier that when you have visitors come, if you can show that you're fully vaccinated, you're okay, come on in. If you can't show, you need to test. So what if that person's fully vaccinated, but they are sick, not showing symptoms? That's my only, and then workforce. I mean, I've had 2 so far because we have a nursing school in my district who can't get the proper testing to go do their work requirement into nursing homes as CNAs. So I've worked with the Department of Higher Ed because they require certain testing and they can't get appointments to do that. And the nursing homes won't accept a home test in order to get in. So we have students out there ready to go do their work requirement, but they can't get into the nursing homes because they don't have the proper testing.
it's not a nursing home requirement, it's a state requirement that those certified nursing assistants get that state test or have the
They're not certified working CNAs. They're in their work program in order to graduate. So they're students.
Okay.
So they're not under the state mandate. They're under whatever the nursing home needs, that I am told, in order for them to get into do their work requirement in order to graduate.
To do their clinical work within the nursing facility.
Yes.
Well, I think there were a number of nursing facilities that were reticent to allow students in at certain points of the pandemic. Early on, we didn't allow it. This past semester in the fall, we had 3 high schools and one of the LPN programs, their students were here doing their clinical work. So I think it depends on the facility and their capacity and their staffing and their outbreak. I think each building has a separate set of criteria to allow that. Ann might be able to.
I thank you. And that is going on out there. I mean, being here with a nursing school in my hometown, and I had 2 reach out in the past week and they just want to get going on their program. And I think it's just, I think we're looking at this. If you're testing just non-vaccinated and you're not testing the vaccinated, you're bringing people into the building. We want to keep everyone safe. And when we see all these breakthrough cases, I just look at it differently. So thank you. And thank you, Representative Abercrombie.
You're welcome, Representative Case. Representative Cook.
Thank you, Representative. And first, I want to thank each and every one of you, the staff, the folks that have given their time to discuss, all of the things that are truly passionate about what you do every day with this panel. I do have a couple of questions, and I would like to first start with, so I believe, Loretta, you were talking about the essential caregiver piece and that we had obviously legislated it, it had passed, and you feel that it is in holding. Like we have not moved forward with that as a state. So could someone please speak to that? Anybody, quite frankly, could you all speak to that as to where we are in that and what we need to do to continue to push for this to happen? Because I do believe that that takes off some of the burden on the workforce when our essential caregivers are able to come in and do the job out of the goodness of their heart for the ones that they love. So whoever would like to take that one, I'm happy to start there.
So Representative Cook, I'd be happy to give you what I know.
Mary, thank you.
And Loretta, please, one, thank you, and thank you for all of the work that you guys have done and the support that we've had from our essential caregivers here. Yes, it passed. We have been working with the Department of Public Health to receive the policies and procedures related to the Essential Caregivers Act. I believe that was the directive given through the act that was passed. We've met with family members a couple of times. There have been some changes to the timeline related to getting those policies and procedures out due to competing priorities and the emergencies that have come up. We have been asking for the finalized policies and procedures related to that. We do have another meeting scheduled with the Department of Public Health later this week in order to see the finalized copy of that. We're hoping to have it out at this point, and I'm hoping, I'd like to hear it from people if it's not happening. Essential caregivers as well as visitors should be having regular access and meaningful connections with residents in the long-term care facilities. So if that's not happening or they're seeing that there's been a pause in that for any way, we were told by the Department of Public Health that at this time they haven't given any exceptions to buildings. They were instructed by the Department of Public Health to work with DPH if they felt any other provisions needed to be put in place, but we don't know of any at this time. But yes, we're hoping to have that this week.
So to clarify then on that, and I appreciate your answer. So are you saying that essential caregivers have not been asked to not come in, that they're giving complete liberties the way that we had envisioned it to be? Or are there still restrictions in where we are?
The current CMS guidance says that anyone who'd like to access a resident, right, visitor, essential caregiver, and we do see them as different. The visitors are coming in to visit, essential caregivers coming in to access and provide support to the individuals that are there. There shouldn't be a barrier to that, as I think maybe it was either Anne or Pat brought up that, they're screening them even if they're positive. They should be, if the resident is positive for COVID, they should be educating the person coming in to see that individual and giving them the choice. The only time someone should be turned away or told that they can't visit is if they test positive at the door. If they're showing symptoms, so they're looking at them if they have a fever, if they're showing signs and symptoms upon screening at entrance, at that point, they should be asking them not to visit. Other than that, I'm hoping that we're seeing unimpeded access.
Thank you. And I agree. I would hope that we are as well. I know that there's been some hurdles over the last few months in different facilities across the state, not near as where we were before. But I also think that's individual. And then we still have the issues with COVID outbreaks, and facilities may not have people to stand at a door and screen because they're so low in staffing. But I'm not saying that that's an excuse to hinder somebody from walking in to act as that essential caregiver. Patricia, I see you nodding. And, for me, it was so vitally important that we passed that legislation. And, hearing the horror stories from all of the folks that had loved ones that were only being able to see, and we were one of those families that you were only able to see your loved one from a window, only if you were fortunate enough for that family member or loved one to be on the first floor. And so, you know, those are things that we definitely need to continue with. I did want to address also, so Jesse had discussed the $11.99 from $11.99. I think he's still on here about the pay. And I know that we had increased pay over the last few years. We did it prior to COVID. I know that one of the nursing homes in my neck of the woods held the pay and then turned around and sent a letter and said that they couldn't give the increase because of COVID. So that increase should have been done months prior to COVID. So then they used that as a reason to not give the increase that we had already legislated and allocated for the facilities. Part of that has since been rectified, but I'm curious as to why the seasoned staff, if you will, did not get a boost, because that was also part of that legislation. So I'm curious as to why that didn't happen. So I don't know if Jesse can answer that or if somebody else could address.
Yeah, Representative. Yeah, all of, particularly in all of the nursing homes that we represent, which is 1 out of every 3 in the state of Connecticut, all of our members received sizable increases based on the state funding. But the state funding you're talking about in 2019 was only 2%. So when you make $15 an hour and you get a 2% raise, that's 34 cents. You know, this last summer, the increase on Medicaid was 4.5%. Now, 4.5% moves people quicker. And yeah, you can give nursing homes money over, you know, there has been increases in 18, 19, 20, 21, and another one in 22. But you're talking about a 1% or 2% increase. And when you're already low paid staff, in some cases, certain operators, some of which are on this call, pay dietary and housekeeping workers minimum wage. Well, when you pay people minimum wage and you give them a 2% raise, that doesn't really advance them. Now, in our nursing homes, because of the power of collective bargaining, we're able to capture far beyond the state funding to increase wages and benefits because of the power of being in a collective bargaining situation. But still, 2 out of every 3 nursing home workers are not represented by a union in this state. And therefore, most of their employers are for profit and make choices every day about where to put that money. You know, there's been regular and consistent studies done by both the federal and state government that show that large corporations that operate in this industry regularly, the more layers to their corporation there are, the less staff there are on the floor. And that is a clear indication of part of the historic crisis in this industry and the necessity of having far more robust financial penalties for operators that continue to take the funding allocated by our state dollars and our Connecticut citizens out of state for corporate profits. And that's a real problem. You know, I think that, you know, to go back to the more holistic picture that a lot of people have been talking about is, you know, in 99% of our facilities that we represent, we have a training and upgrading fund. It costs the employer 1%, but it pays massive tuition cash benefits for anyone in a career in healthcare. And almost all of our facilities that we represent, which is 1 out of every 3 in the state, we have a career ladder in nursing departments from CNAs to LPNs to now RNs. One of the biggest hindrances in the education system, there is a clear difference in the nursing field between Black and brown communities and white communities. In Connecticut, RNs are historically overwhelmingly white in this state. But RNs don't practice significantly in nursing homes. They are supervisors and management. 90% of the care given by nurses in the state of Connecticut are licensed practical nurses and associate's degree level education. The overwhelming majority of people who have the LPN licensure are Black and brown in the state of Connecticut. And that is one of the large gaps in the state's education system. Not a single public institution in the state of Connecticut offers an affordable LPN licensure program. They're done by 3 for-profit colleges that have just this year notified all the applicants that they will not graduate on time because of the pandemic and increase tuition. This state is suffering from a massive shortage of nurses now, and it will grow to a bigger problem if we don't address the educational gaps based on geography and race that our state suffers from. And in particular, that plays out in the nursing homes.
So, and thank you for all of that information. And I knew the answer to the first part of that question, but I think it's vitally important that that gets expressed over and over and over again, because when we go back and we say, we need more money, we need more money, we need more money, we get the exact response. We just gave you an increase, we just gave you an increase, we just gave you an increase. And I think that you expressed that beautifully when it talks about the need for overinvestment of what might think is, to where I would say that we have underinvested in the folks that are doing yeoman's work. And so thank you for that and the description. I would like to, if I may, Representative Abercrombie, just to piggyback on his last statement there on the nursing LPN and the disparities on the education and the for-profit institutions. All right, it's a public forum. You have the floor. What are those 3 institutions that are for-profit that are only offering LPN programs? And please share that with us.
There's Stone Academy, Porter and Chester, and I think I forget the third one. I forget the third one. I'll let you know. I know that on our end, as a trustee of our training fund, which is jointly operated by nursing home management and the union, that a vast majority of the applicants that we are supporting to go through LPN school, Lincoln Tech, thank you. Got my nurse right here in the room with me, who is a graduate of Stone Academy. Yes. There are significant problems. You know, Stone Academy has had regular complaints of aggressive and abusive lending practices. And, you know, you're working, the vast majority, by the way, in some of the larger companies that we represent, the majority of RNs are former CNAs who became LPNs, who became RNs. And that continuity of care, as many of you have said, is vital, because you know how someone likes their peanut butter sandwich made. It's those little things that make the work human. But you have this economic gap in education. You know, you have a CNA who's making $17 an hour, raising a family. Now they want to go to school. Well, they have, even with our very generous tuition benefits, which are thousands of dollars a semester, plus we help support people on books and tutoring, you still have tens of thousands of dollars of debt that they're accumulating. And they need to be an LPN in between getting an RN, because they have to continue to work to pay for their families. You know, it is the privilege of the few of us in our society to be able to go straight to get a bachelor's degree. Very many people have to work through life, pay for their family, and then add education on top of it, particularly after high school. And that's why so many caregivers in the LPN licensure have to stop, because they have to start paying off the loans, and they need the pay raise now to support their families and the loans they just took. We need a public option that's affordable for LPNs in the state of Connecticut. If we don't do that, and by the way, one person mentioned it on the call, nursing home jobs don't leave the state of Connecticut, right? It's investing in this industry is an investment in our communities, an investment in the state tax structure, in our institutions. We invest in nursing, particularly in long-term care. We will be investing in our own economy. And it's really necessary. So there are these racial and economic gaps that exacerbate the staffing crisis. To a point, there was a shortage of workers before this pandemic. And the pandemic, you heard from Michelle, who is one of the sweetest caregivers I've ever known in my life. And she can't do this work anymore. And we were talking a minute ago, and it's getting a little emotional, but she's done this for 30 years. She's a good caregiver. Her back can't take the work anymore. Thank you.
Thank you. Thank you so much, Representative Abercrombie. Thank you for giving me the time. Again, I just can't thank you all enough. This breaks my heart, and I'm hoping that everybody that listens, it breaks theirs too. And I think that's the only way that we get something done. So thank you all for what you're doing.
Thank you, Representative Cook, and thank you, Jesse, for that information and just the realization of what's going on out there. Lorette, followed by Representative Santiago.
Thank you, Madam Chairman. Thank you, Representative Cook, for bringing that to the fore, and I echo your sentiments. What I think we need to do is, because of staffing shortages, it's so critical, we need to mobilize the workforce that we have that is family carers. People that are willing, we need to work with family councils, strengthen them, make sure that people at the building levels understand what their rights are, not be barred at the doors, metaphorically or physically, as far as if you were tested yesterday, try to make it simpler and easier for you to get in today. Take a poll within the facility. Have the administration find out who here has a family carer, a dedicated family carer. Make them aware of the current laws that are in place and post them. And I know that this is supposed to be happening, but really just let people know that this legislation is in place and try to mobilize these family carers and welcome them in, because we really, the gap is so great. We really need the support, and these family councils, when asked, there's no one more passionate that will be able to enact these types of, to get this kind of work done. And it's never been more critical because we have this gap in care because of the staffing shortage. So that would be my low cost, no cost paradigm shift to enable people in long-term care to receive better care. There's no reason someone that's got a family at the ready, they don't know what the rules are. The rules are different every day. If we could get these laws, that are already passed, raise awareness, and for the laws that need to be passed, get them passed and give them, public recognition and give them the platform, and to know that these are in place and that you are welcome in and that you are encouraged in. And then family councils can, as Representative Cook said, these people are doing, like the CNA is, the yeoman's work, and we need to support them. And the best way to do that and not have financial repercussions for the state while we get good people trained and mobilized would be to let the family carers in and let them know that they're welcome in.
Thank you, Lorette. We do appreciate your comments on this issue. Being the fact that you live it personally, it's always important for us to hear that. So thank you very much. Representative Santiago.
Thank you. Thank you. Good morning. And thank you, Representative, for letting me talk for a couple of minutes. I guess that I would direct my questions more towards Jesse. He's still on, right? Yeah. So Jesse, wasn't there a survey or a survey that you did within 1199 about the caregivers, the CNAs? Because I went to that forum.
Yeah, we've done a number of different surveys and focus groups and things like that to find out where our members are at on a lot of these issues.
Okay, so was that disseminated to the rest of the legislators, even to Human Services Committee?
I don't know in particular what was shared with the legislature or not, but
Mhm.
I know that there was, and you may be also referring to, we recently did a really massive survey of our PCA membership,
Mhm.
which is part of this long-term care continuum. They work in the IP Medicaid waiver program through DSS. And there was a significant survey that was just conducted with that membership around issues related to their economic conditions and non-economic conditions of work.
Okay, thanks. Thanks for that. Because I attended one of those meetings that you had, and it was astonishing to me that getting paid $6.25 an hour is basically what you start off at Amazon. And at Amazon is you don't have to deal with people, you deal with packages, and you get paid more. McDonald's is even paying more than that. And it's just that $16 an hour, $16.25 an hour, you're still on Husky, you're still on Medicaid. How many of these employers offer insurance to the PCAs or their employees, and it's too expensive because they can't afford it, right? So now they're on the system. So now they're on Husky A, because there's 4 types of Huskies, and they're also on food stamps because they can't afford to not have health care, and they can't afford not to get help with the SNAP program. So it just astonishes me that folks are still making $16 an hour, dealing with our most vulnerable population, the population that is a precious population, and it's getting older. And I just don't understand why we are still battling with the pay in the state of Connecticut. And to live in the state of Connecticut, you have to make $27 an hour to live comfortable. And we're not even there yet. Even with $15 minimum wage, we're not even there yet. And we are going to face, like you said, a historic crisis with the staff shortage. And our population, especially in the state of Connecticut, is getting older. And more people will be in these homes because as their kids are working and their kids can't, they're working later and later into their 50s and 60s, can't take care of their parents that are in their 80s and 90s. So we need to really look at why that is happening. And we need to make sure that they're making the money because we're paying them $16.25, like I said, but they're still using the system. They're still on the federal system, still on Medicaid and still on food stamps. And it's very hard when you have 2 and 3 jobs in order to advance your career and become an LPN. And now that I see that there's only three schools that license LPNs, I think one of the things we need to look at is looking at community colleges to offer these licenses, and so that it could be a lot cheaper and give them the competition, because I can't see somebody from Meriden that probably doesn't have a car or has to borrow a car or has to pay for gas to drive all the way to Stone Academy in Stonington. Isn't it in Stonington? So, I mean, that's about an hour's drive almost for, 50 minutes or so. So I think that we need to really look at what's happening in the state of Connecticut with our CNAs, with our PCAs, with the nursing homes, and who's really making the money here. And the other thing is like, it's almost like looking at childcare and looking at Head Start teachers and looking at preschool teachers that are still getting paid $15 an hour to take care of our precious population, our children, and they're not getting compensated for it. This is why we are losing people we are losing folks to places like Amazon and losing to people like Home Depot that are willing to pay them a lot more for less stress and give them better insurance. So I think that's something that we really need to look at. And I want to thank you for telling me about the survey and your unveiling of the survey. The stories were heartbreaking, with especially the gentleman from Meriden that has been working there for many years and that has no health care because he can't afford it. He can't afford it to buy it from his employer. So those are a lot of things that we really need to look at. And either we put some kind of task force together or do some kind of study, but something has to be done immediately because in the next couple of years, this is going to get worse. So thank you, Jesse, for being here. And thank you for the women that came to testify. It breaks my heart too, like Representative Cook said, that we are still dealing with all this poverty and we're not getting people, we're not helping them lift themselves up from their bootstraps. We're just making the poverty cycle longer because they're never going to get out of it. If we don't give them the incentives, we don't help them out, and we don't give them the wages that they deserve, especially taking care of our population. So that's all I basically wanted to say. Thank you for being here. Thank you for everybody else to be here. The long-term care ombudsman, I want to give a shout out to her because Ms. Panter has been great, especially with all the referrals that we sent from Senator Murphy's office. She has been great dealing with them, and also from my state office. So thank you, Representative Abercrombie and Senator Moore, for indulging me and just speaking out what I felt about. And everybody really needs to go to a presentation for $11.99 and listen to the surveys and the testimonies that these folks have, because it's if you don't hear the testimonies, then you don't know what's going on. Thank you. Thank you, Representative.
Thank you, Representative Santiago. Representative Panter. Sorry, Marie, sorry. I'm looking at your name. I'm like, why isn't she responding? I'm sorry.
That's okay. I was confused. That's okay. Look, to some of the points that have been made, I wanted to highlight, when you look at the system and you see people, we see people leaving and going to work with the pool because they want that livable wage. They're also giving up their healthcare insurance, those other access to those other things that help support them. And what we're hearing, when we're looking at the shortages in staffing and the hours, is that when they are on state benefits, they can only work so many hours. Otherwise, it will bump them off of state benefits. And so it's almost like we're in this vicious cycle right now where we don't have enough staff, but they can't pick up more hours because they'll lose the health insurance that they gave up originally because they left the nursing home to get a livable wage. And it's just, so I just wanted to point that out. It's just another layer of complication to all of this because they're trying to receive a livable wage. But thank you for all of the attention to this.
Yeah, and you make a good point, Mairead, that it is a vicious cycle, but it's a cycle that we have to address and we have to figure this out, because I think everybody that's on this Zoom agrees that we all have a responsibility to take care of our most vulnerable population, which are our families. So you're absolutely right. Anyone else with a question or comment before we close out? If your hand raising isn't working, if you want to just raise your, shake your hand, I can address you, call on you that way also. Seeing none, I want to just really, again, take this opportunity to say thank you to everyone that participated. And I also want to say thank you for the fact that I think that everyone was really honest on this Zoom about what's going on out there. And sometimes it's hard to take. As Representative Cook said, our heart goes out to the workers that have been on the front lines. Our hearts go out to the families that have not been able to see their loved ones. We as a state and as a country have never been in this situation before. And this pandemic has really highlighted some of the areas that we really need to work on, which are nursing homes. But it's also shown us that together we can get through this. And it's hard, and it's going to continue to be hard because we're not done yet. But we're hopeful that the numbers will continue to stay low and that people will continue to stay safe. So with that, thank you everyone for participating. The legislative session officially begins tomorrow. So stay tuned for Human Services. And let me just say this, we blink and the session is done. It's a short session. We have exactly less than 8 weeks to get our bills out of Human Services. 8 weeks. Our JF deadline is the end of March. So keep that in mind. If you have legislation and we haven't received it, you're probably not going to get it, truthfully, because we will be screening by this week and next week, and then we'll be off and running. So thank you everyone for being here. Stay safe and have a great day.